And we welcome to our spotlight on the Salem Memorial Hospital. We've got Amber Hogan with us today. Good to see you, girl. It's been a while.
It has been a while.
Well, it
Yeah,
has
it's good
been
to
a
be
while.
here.
Well, it's good to have you here. Amber's one of the nurse practitioners at our clinic. We do appreciate you being SMH Family Medicine. I still throw that D in there
Yeah, I
occasionally.
think we'll
I've
always
been
do
there
that.
for a while. But anyway, so how are things going? Want to get us up to date a little bit on how the practice is going?
Good. It's good. I've kind of transitioned over. Since we have so many providers up in the clinic, we are fortunate to be able to do a lot of the walk-in traffic, even amongst patients from Mercy and Phelps. It's hard because chronic care is such a big thing that it's hard to get into your provider when
Sure.
you actually have an acute or a sick visit. So I've kind of transitioned. I'm not really establishing patients right now. I'm kind of doing just all of the walk-ins. So then our community can have that service to be able, when they're sick, they can be seen.
Sure,
So-
absolutely. But you're kind of like a jack of all trades, though. You are very good in wound management, correct?
I have, yeah.
You're certified in
I am
that,
a
right?
certified wound care nurse practitioner. Yeah, I do that. And-
Explain what that means, because I don't think people have a real idea. A wound, well, okay, a wound. Is that a little slice on my hand, or is that half my arm cut off? You know?
Well, no,
or is
I
or
don't
is it a
like
little
half the arm.
combination of both?
Yeah. So a lot of people that have chronic conditions, diabetics are really, really big.
Yeah, right.
If they get a wound, it takes a longer period of time to heal. So it might entail different dressings that have specific properties to it to help the healing, and so or debridement and stuff like that. And I can do all of that. I'm certified to do all of that. So.
Yeah, and diabetics have to be very careful. I know a real good friend of mine. He unfortunately had real bad diabetes and ended up having to have kind of, I'll say, a slow progression of amputations
Yes.
on
Yes.
his toes and his foot and actually part of his leg
Yeah.
as the circulation just stopped. But he had gotten a cut on his foot and it had gotten infected. It never did heal.
Yeah,
you
and
know.
the issue with that is diabetes. Sometimes they have what's called neuropathy, so they can't even feel it. So some of the patients don't even know that they have a cut or even like an ingrown toenail or anything. So it's very important for them to take a look at their feet every now and again. So with the wounds, it's important to start getting treatment very, very early, so then hopefully we can get rid of the infection and it not progress where it ends up in the bone and then they have to have it amputated.
That's kind of an art, wound treatment, isn't it?
It
I
is.
mean, because you have
Some people
to.
can't do it.
Oh no, some people can't, but you have to actually look at it and diagnose it, and see if there's an infection. It's not just treating the and not just your treatment that you're doing, your bandaging. You have to get it to a practitioner or yourself. You have to get some antibiotics in
Yeah.
there,
Oh, yeah.
or something else, or maybe it might be a topical antibiotic cream. Maybe not actually taking physical pills or capsules, but you have to actually assess that situation kind of on the spot, don't you?
Yeah, yeah, and depending on how it looks and also
Yeah,
smells.
see the faces. Yeah,
We can culture it, and then when it comes back, we generally, even before the culture comes back, depending on how bad it is, do a broad spectrum antibiotic, and then when we get the culture back and see exactly what the bacteria is growing, then we can do a more specific antibiotic to it, and hopefully catch it before it starts progressing to even worse. So.
Yeah, and that's the last thing you want to do is have that infection continue to grow,
Yeah.
or get into another part of the body. You know, that's always the scary part.
Yeah.
And it doesn't matter whether you're diabetic or not. People sometimes, I remember years ago when somebody remembered I had a incident that. Probably don't want to brag about too much, but I actually cut my own toe off. That's not
Oh,
a real
wow.
good idea to do that. But, most people say, well, did you get a tetanus shot? Well, I already had one, but I said, you know what? I don't remember exactly when I had it. I'm not taking the chance. Give me another one, go ahead and do it. But people forget the tetanus shots don't last forever. They get one and they think, I already
I'm
had a
done.
tetanus shot. No, you might have 10 years ago, but if you've come in contact with exposed metal to the air and things of that nature, and you do have a slice, you need to get that tetanus shot because you really don't want to have that spreading through your body. Do you?
No, not at all.
But the importance is that people need to know kind of where they stand on some of these type of shots, because I think it was every 10 years they recommend a tetanus shot.
Yeah,
Is it
unless you have
something
an
like that?
injury.
Right.
Yeah.
Right.
So then you get another one. But other than that, if you don't have an injury, then it's good for 10 years. So yeah, it's important. I mean, it's to get established with even if you don't have a whole lot of chronic conditions or whatever, get established with a provider. So then you can keep up to date with all of those vaccinations and your preventative care, if it's colonoscopies, mammograms,
Sure.
stuff like that.
And you've helped people along with obviously your wound management and things of that stuff, because it's good for you. Obviously, you have to keep records, but the patient should keep records as well. They should know where they stand on certain things, don't you think?
Oh, yeah, yeah. Even if it's amazing to me how many people even not even just like their vaccinations or immunizations, but their medicines. There's so many patients that they're on say 10 different medications and they don't even know what they are or what they're taking it for. So it's good to be knowledgeable about what's going on with you and your body and all that kind of stuff.
So I want to ask you a couple questions, because obviously you've dealt with this and you're ready to help people on that emergency basis when they come into the clinic, okay, on Saturdays. But a lot of people, like you're mentioning, are taking we'll just say a diet of pills, medications, call it whatever you want to, but a lot of people don't realize that there's a lot of interaction with some of those medications. And unfortunately, I've had some blood pressure issues where I've been put on so many different medications. I've gotten about halfway through and I find out this isn't working, and they take me off that one, put me on another one. Well, I got half a bottle of this stuff, and then they tell me to hang on to it just in case. Okay, so you're getting this, I won't say mass dosage of different drugs to treat my diagnosis, but you're getting possibly 2 to 3. Okay, well then the next time you're going to drop those 2 and add these 3. And then you're going to drop these 3, which are different than the other ones that they just change and add these 2. Some of them are simple. Vitamin D, not a big deal.
Right.
That one's an easy one. Pretty good confident with vitamin D. It's not going to change much.
Right.
That one's pretty good. Vitamin E, if you have to take that, or even B or whatever those are pretty common. It's when you get into the prescription medications, though, I don't think the average person, if you show me amlodipine versus dimetavine or something, I wouldn't have any idea what family that's from, or is that doubling my dose? You don't really know. And as you ask the doctor, they're going to explain it to you.
Right.
But then you're going to go back the next day and you're not really going to know. And then they might change your medication again. So then you get even more confused. But in my case, I had some medication I was taking. They wanted to add another pill. When they did, pressure in my head went crazy.
Oh.
So what you're saying about patients realizing the things that something isn't right.
Yeah.
It could be the medication
It
you're
could
actually
be.
mixing with the other medications you're taking, because
Yeah.
everybody's different.
That's exactly right. Just because one medication is going to work for one person is definitely not going to work. I mean, it might not work for a different person because everybody is different.
And you need to look for those changes quickly. I mean, sometimes it might take a little while, but other times they may hit you within a day.
Yeah, it's good to be self-aware, especially whenever you're starting a new medication, just to kind of assess yourself and are you feeling any different, especially looking for any reactions or anything like that.
Rashes are easy to see, but sometimes you get buzzing or
Oh, yeah.
fogginess in your head, or just dizziness or whatever it might be. Those can also be reactions to that medication, can't they?
Yeah, yeah.
When people do get that, and I know I did, they need to contact their practitioner right away, but sometimes that happens on a weekend. Not easy to get a hold of your practitioner, but you do need to follow up on it quickly. Stop taking the medication if you know it's that medication
Right.
until you can get to your nurse practitioner, but
Provider.
or provider,
Yeah.
whoever it might be that you're going to, and then tell them what you're experiencing, because they may ask you other questions like, what did you eat? What are you drinking alcohol?
Yeah,
There could be a number of different outside forces, not just the medication,
yeah.
that could be affecting this. Is that not correct?
It is correct. And you mentioned, it might happen on a weekend. So just to inform everybody that we do have the walk-in clinic on
Right.
Saturday. So, you don't have to be just a patient at SMH Family Medicine. It can be anybody can walk in on Saturday, no appointments. There might be some times that you might have to wait a little bit because it'd be just like going to an urgent care over in Raleigh. You're just not having to drive to Raleigh. So,
Right.
but yeah, if you get sick or anything like that, you can stop in on Saturdays at our walk-in clinic.
So you've been on the nursing side and to the family nurse practitioner side, right?
Yeah, and I also was a respiratory therapist for 11
There you
years
go.
before that. I've worked in healthcare
Man, oh
for
man,
quite a while.
You got quite the resume
Yeah,
here.
yeah. My background is in emergency medicine. I spent my nursing career in ER and then transitioned over to ambulance and then nurse practitioner. So that's why I really like all the acute visits because that's just my background. So.
But it will keep you busy.
Yes, it does. And especially right now, there has been a lot of different viruses going around. Influenza, we're seeing some COVID, rhinovirus, endovirus, and stuff like that. So it's strep throat. We've just been busy.
Yeah, we had a rash of strep. I heard about it. 2 weeks. It seemed like 8 or 9 people I knew had strep. I thought, wow. Usually they can find it pretty quick, but that seemed to be an awful lot of cases that were being brought to my attention. That kind of makes you not want to go anywhere.
I know, right? Everybody says that, well, I haven't been anywhere, and people don't think about, you go to the grocery store or even pumping your gas.
Oh, yeah, that handles.
Those handles. There's
gotta-
no telling how much bacteria or viruses are on that handle. So, and then you don't think about it. You don't wash your hands, and then you end up with something. So.
Or even going to church, the
yeah.
handle to the church door. People just forget. They just go up there, grab that handle, open the door. Well, everybody else did the same thing. And, if they had something on that hand, they're going to be maybe passing it on to you.
Yeah.
And that's one of the things that we always try to remind people is to wash your hands.
Yes.
And do it consistently. And don't just go underneath there and put a little spurt of water and tab of soap and yink, 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 and I'm done. That's not going to really get the job done, is it?
That's true. And, I think everybody was a lot more conscientious about it whenever COVID was so bad. And they harped on, either using the alcohol and stuff like that or washing your hands. And as COVID has fell off, I mean, it's still around. It's still going to be around.
It's gonna be
that we haven't been as conscientious about washing. And I know I haven't been because whenever COVID was bad, anytime I'd pump my gas, I'd get back in, and I had alcohol everywhere in my car, in my purse, and
and hand sanitizer is still out there. You can still, and you should do it. Or I remember at one time at a lot of the gas stations you go to, they actually had gloves.
Yes.
Little just plastic gloves to put on your hand before. Of course, when you're reaching into the box, remember you're touching a dirty box.
That's true.
So it's everywhere.
It is.
And one of the things I always remind people about is when you go to the grocery store, and a lot of people don't think about this, it's not the cans and stuff that you pick off the shelf that's probably always the biggest problem. It's the ones that you pick off the shelf and put back.
Yeah.
Because if you have something, I don't want those green beans. I'd rather have this can. It's cheaper. And you put that one back, well, whatever you had on your hands is now on that can.
Yep. Yep.
And so I highly recommend it. I know I started doing this because I remember getting just extremely ill after going to a grocery store one time, and I knew right where it came from. I started feeling bad about 4 hours after I went to that grocery store and felt even worse the next day.
Yeah.
That every time I come back from the grocery store, first thing I do is wash my hands.
Yeah.
Then I unload the groceries, and the next thing I do is wash my hands.
Yeah. Yeah.
So once you put them in, now if you're just using it right away, but I also remind people, even if you put that can in your pantry, when you pull it back out, before you eat with those hands, make sure that you wash your hands again.
Yeah.
You just don't know what might be hanging around waiting for you.
No.
And it might not be a good thing.
No, and you don't want to get sick. So.
No, we really don't. And we're getting near to springtime. People are going to want to be outside a lot more. And we've had some really good weather.
I know. And I think I've seen a lot of people with like COPD, breathing issues, and they're having a little bit of a rough time because it was so cold last week, and then now we have such warmer weather this week that it's messing with their lungs a little bit.
A little
so.
bit, but also need to start thinking about it. It won't be long before the allergies start kicking in.
Oh, yeah.
It'll be probably in late March. We're going to start seeing that. And as windy as we're talking about being today and tomorrow, and then maybe even into Friday, man, you're talking about a lot of pollen being blown around. And right now, even though we're not in a growing season, you got a lot of southwest winds coming out of Texas. They are in the growing season. So there could be some pollens that are making their way up to us.
Yeah.
Not normally what you see this time of year, but it's been so warm.
It has been, yeah.
Of course, it was so cold there for a few days.
It was.
It doesn't kill it. It just kind of makes it dormant. This time of year, I mean, we're getting close to, obviously, Valentine's Day. We always talk a little bit about hearts and how important it is to take care of your heart and to really monitor your heart. I know with my blood pressure, I've been, unfortunately, for the last 2 months, over-monitoring it, but probably much needed to do until we found the right mix of prescription medications and outside prescription medications, over-the-counter ones, that will bring my blood pressure under control. But everybody else should be watching out for their heart this time of year anyway, shouldn't they?
Yeah, they should, and that kind of goes back to your preventative care too. So, especially if you are ever having like chest pain or anything like that, don't push it off. Definitely seek attention. If it's really bad, then go to your nearest ER because you don't want to end up having a heart attack, and it's safer to be checked out than to just let it go. And if you feel like you're having some high blood pressure and stuff like that, then it is good to go to your provider because you don't want to have a sustained high blood pressure because then that affects your other organs too. It damages your heart and it can eventually damage your kidneys and just a whole bunch of stuff. So.
And to go through all the tests to find out what it is doing to you takes a long time because you have to eliminate one thing at a time. And there's so many, like you're mentioning, kidneys, okay? Who's thinking you're going to have the problem with your heart's going to be your kidneys? It could be.
It could be, especially if you have what we call refractory hypertension, just like, we add medicines, and it's still, your blood pressure is still high. And that's one of the things that we look at is your kidneys. Is the kidneys causing the high blood pressure? So,
but there's other things. I mean, I had, your carotid artery. You want to make sure that that's not being clogged a little bit. And then the circle of Willis. So you want to make sure all the blood's flowing where it's supposed to be flowing to make sure. And there may not be a real reason why your blood pressure is high. And a lot of times, though, Amber, and you can probably tell people, it's just outside stress.
Yes.
Stress that's brought on by family, stress that's brought on by the job, stress brought on for whatever reason. And that, no doctor can diagnose that stress. Only your body can.
Only your body can. Yeah.
So don't put it off. I know that, like I said, in my situation, it's a 260 over 180.
Oh, gosh. I bet that made you feel pretty bad, huh?
Well, yeah, and your head is heavy, and, it's not good. When I walked in there, I mean, they were like, we're ready to put you in the hospital. And I said, I understand that. That's why I'm here, because but it spiked. It was just spiking, and no idea why. But we've got it down to where we're down into the 130s and 140s now, which is good. That's, it took a long time to get there. Yeah. But we're finally there. Yeah. But it's something that I think people need to be much more aware of. You may not realize you're a little bit high, and your blood pressure is never going to stay at 120 over 80. I don't care what they tell you.
It's always fluctuating.
It's going to bounce all the time. Yeah. And you're going to have daily stresses, too, that can just shoot it up a little bit. Okay, so don't be too extraordinarily worried over that. Right. But if you're at 180, 190, over 110, 120 all the time, you've got some issues. Yes. You need to get it. You need to get checked out, and don't put it off. I said, because you only have one heart.
That's right. You're not going to grow another one.
No, it's not going to. It's not going to repair itself. No. And to do the damage that high blood pressure can do, I always had a little bit higher blood pressure than normal. Even when I was a little kid, I always did. So, okay, I understood that. This 120 over 80, it was never in my vocabulary. I don't think it ever was 120 over 80. But 133 over 84, 88. Not really far off that. It's just that's where I was.
Yeah.
when you're 6 years old, you got no stress.
Right.
You know, so the doctors, he just basically told my mom, told me, don't let somebody put you on medication for that. That's your normal. That is your normal. That may not be everybody else's normal, but that's your normal. So somewhere, I figure 128 to 136 over 82 to 88 is probably my normal.
Yeah, that's good.
No,
Yeah.
but it's just okay.
Yeah.
But then when you're starting to get above that consistently,
Yeah.
you need to start worrying a little bit about getting the right treatment for you. And it may not be the first one. It may not be the second one. And you
Right.
may have to go through the same gambit as I did. And I'm just going to, hopefully our listeners, listen, I had chest pains. They weren't severe. There was a dull chest pain. And I actually worked through it for 8 hours.
Oh my.
And then went to the hospital. And I got there, and I had to have nitro, and they checked it all out, and couldn't find anything wrong with the heart or anything of that nature, but I had to get my blood pressure down.
Yeah.
It was high. But that pain was just a dull, nasty pain. No sharp pains in my jaw, no pains in the left arm, but still, it's not a very smart thing to work through that.
No.
When you get it, don't, and I'm highly recommending people, don't think it's going to go away. If it's not gone away in 2 to 3 seconds or 4 seconds or 5 seconds or maybe even a minute,
Yeah, you need
get your tush to the hospital or call 911
Yeah.
and have them come and get you. That's just not a real smart thing to do.
Yeah.
And then the next time I had to go, I got dizzy. I was standing there and the whole world just kept spinning.
Oh yeah.
And the blood pressure was over 200 again. Don't let that happen, guys.
Yeah. And another thing, a lot of people they end up having to start medication for their blood pressure, but then for some reason they think, they take their blood pressure and their blood pressure gets in a normal range while
Because of
they're
medication.
on because of medication, but they think, well, it's normal, so I don't have to take the medication. But the reason why the blood pressure is in normal range is because of the medication.
Sure.
So continue to take the medication because then you'll be in a rough spot again without it. And then, when people are diagnosed with hypertension and say if their blood pressure is like 180s over 100s, it's going to, especially if you've ran that high for a period of time, you get started on medication and it's bringing your blood pressure down, you're probably not going to feel real great. You might feel fatigue and stuff like that.
Oh, yeah.
It's
It
because your
changes.
body's not used to running in that normal range. So you just have to give it some time to get your body equalized
Right.
to a normal range of blood pressure.
But let's also take that the other step further. If you stop taking your medication, it's not going to change the next day. It may take 2 to 3 weeks because that's the medication's in your system.
Right.
And you're not going to see it every day because the blood pressure may be inching up very slowly.
Right.
And then the next thing you know, you're going from 138 over, say, 88 to 148 over 92, 160 over 99. And
Yeah, and it
it's just
keeps
inching
going.
up.
Yeah.
And all of a sudden it can hit you pretty quick. Kind of what happened to me. I was on blood pressure medication,
Oh, okay.
one pill. And for whatever reason, we couldn't get prescription to the pharmacy. Somehow there's some mix-up. One supposedly said they sent it. The other one said they called, no answer, this and that. I mean, whatever, went back and forth. 6 weeks later, I got my medication back, but that's when my blood pressure problem started because I did not take that medication for 6 weeks.
Oh, goodness.
So all of a sudden, you could feel it amp up.
Yeah.
So you don't want to do that if it's, especially if it's that kind of medication where your body is used to it. It could react adversely to not getting that medication.
Yeah.
Drugs can do some different things to your body.
Yeah, they can.
And it does, like anything, your body relies on water because you have to have it, but also it relies on food, the right nutrients, exercise,
Right.
diet. If you do things that go against your body's norm, you'll feel it, won't you?
Yeah, you will.
So I wanted to bring that out only because it did happen to me, and I want to make sure people understand the importance of following the medications you're on, staying with them, and like you're saying, just don't think, well, I'm feeling great, I'm just going to drop these medications.
Yeah.
But if you do feel an adverse effect immediately off a medication, that's a different ballgame.
Mm-hmm.
You know, because allergies, they are real. You
They
may
are.
be allergic to some medicine that's
Mm-hmm.
in that prescription, or may mix with some other medications you're taking. Or the worst thing is Amber, that somebody's taking over-the-counter drugs and not telling their doctor,
Yeah.
and then they're mixing it with a prescription, and then that is definitely not
Yeah,
working at all.
and like you said, you have your vitamin C's, vitamin D's, vitamin E's. They're not necessarily gonna mess with a whole lot of your prescription medicines. But when you get into start taking a big one is St. John's wort over the counter, it has a lot of different interactions with different medications. So it's you should really talk to your provider before you start any of those over the counter medications.
I remember reading, well, this is a few years back, I don't know if it's still there, that some blood pressure medication you could take with orange juice. You could actually just skyrocket your blood pressure because of the acid in the orange juice.
Yeah.
Never heard, you're thinking, just a glass of orange juice.
Right.
Vitamin C, it's good for me, right? Not with that medication, it is.
Right.
I'm not sure they haven't corrected that. I don't know if that's still an issue or
Yeah, I
not.
don't
But
know.
anyway, I do remember that quite a few people had that problem, and I drink mine with water.
Yeah. Well, and
know.
grapefruit juice. Grapefruit
Well,
juice.
again, acid,
It,
yeah.
it affects a lot of medications.
Yeah.
So, yeah.
Yeah, that any of those citruses that have that acid
Yeah.
can definitely do some. Well, it increases your stomach acid, which then increases the way that medication,
Yeah.
it changes the medication. So,
Yeah.
and again, always follow the directions. And I highly recommend, Amber, and I'm sure that you will confer with, or consensus with me on this will be a positive one, that to read whatever your prescription documentation is that you get with your new prescription, read it.
Oh, yeah.
Most people sign it, and they get it home, and they tear the bag open, and promptly goes in the trash. My doctor told me to take this. But your doctor may have also told you a few side effects, but there's probably
A
another
whole lot
12 more.
Yeah, because we're
that-
not going to go
No.
over every single one of them. But, yeah, you should definitely read the paperwork. So then you can be, like, going back self-aware of what's going on with your body.
And it's very important to do that. And then when also to take the medication. Your doctor may not tell you that's best to take that with a meal. And it may say in the documentation it can be with or without a meal.
Right. Yeah.
But sometimes, and I know one medication that they wanted me on was a half hour after you ate is when they recommend you taking it.
Oh, yeah.
A half hour. So you have to eat and you have to wait.
Yeah.
And then you take the medication.
Yeah.
I mean, to get the maximum result that you're trying to get,
Yeah.
you want to follow the instructions that they give you. So please read those. And if you don't understand something, please call your doctor or
Yeah.
nurse practitioner and say, I don't understand what this means.
Yeah.
Please enlighten me. And they'll be glad to get back with you on that. They don't want you taking some medication that you're going to take wrong.
Right, because we don't want it to be detrimental to you,
Yeah.
you know.
Anything else?
I
I think we covered quite a bit.
think we did too.
Some personal things. I'll never tell anybody.
Okay. Don't do it.
Well, I think, in all honesty, when we experience something on the own, that's when you really understand. When other people tell you, oh, I had this happen to me, and you're like, yeah, whatever,
No, it does.
No,
It
hits you in the face
it
like a
does.
frying pan.
And I mean, even like with your family and stuff, I know diabetes is very near and dear to my heart because my husband is a type 1 diabetic. So in his family, he's got his aunts and mom was a type 1 diabetic. So I'm very passionate about people keeping their blood sugar under control because of all the detrimental stuff it can do
Absolutely.
to your body. So it definitely, anything that happens to you or to your family, like you said, it makes it very real and makes you passionate about helping people.
Absolutely. And when it really happens to you is when it's a gut check.
Right.
I know when COVID got me and put me down,
Yeah.
somebody said, well, you'll get over it quick. Well, I didn't get over it quick. I mean, I was in the hospital 5 days.
Yeah.
It almost shut my kidneys down. Nobody knows what something's going to do to you, and you just can't keep ignoring the signs. I thought I was getting a kidney stone. be honest with you.
Oh.
I kept feeling a little just pressure.
Mm-hmm.
The kidney didn't feel bad. It's kind of wore down a little bit, but not terrible.
Yeah.
But 4.2 on the creatinine level.
Oh, wow. Yeah.
Yeah. And I said, so am I ready to go back to the game? I collapsed at the football game. And they said, you're not going anywhere but the hospital.
Yeah.
Now, with these levels, dude, you are going to be admitted. You go, we got to try and get
Yeah.
those kidneys going again. They're not working.
Goodness.
Yeah. So it can get a little scary.
It
And then,
can.
and you don't even know it.
Mm-mm.
You're totally unaware.
Right.
And that's another reason why, and I think we'll end with this, is if you haven't been to see somebody in a while,
Mm-hmm.
doctor, nurse practitioner, even on a Saturday, just a clinic, that just go in and say, hey, look, I just need a quick check
Yeah.
just to see where I stand
Mm-hmm.
right now with my health.
Yeah.
I used to get a physical every year when I played sports, every year. And then now Misha says every 2 years. I don't think that's a good idea. Things can happen in a year that you want to detect now.
Right.
You don't want to detect another 8 months down the road when
Mm-hmm.
if you could have detected it now, you want to do that. But be that as it may, I think that's every parent and every child's choice that's about getting a physical. I really
Right.
do. But I think it's a wise thing
Yeah.
because you go through some of the basics just to make sure that your health is okay.
Right. Yeah.
Now, if you want to do the full lipid profile, you can do that too, but you're going to have to fast to get all that done, and that's fine.
Right.
But if that's what it might take
Mm-hmm.
to get your true reading of where you stand with your blood work and
Mm-hmm.
maybe your urine test and things of that nature, check on that sugar level. You want to do everything you can
Right.
to make sure that, hey, I'm still either within the normal or real close to it.
Mm-hmm. Yeah.
Then that I feel much better. And you're going to feel better about yourself after getting that done.
Right. And I mean, if you do that, like if you want to call it maintenance care, preventative stuff, then when something is found, it's probably going to be at the beginning of whatever it may be, and not you haven't been to the doctor for 5 years, 8 years, and then when something is found, then it can be really bad. So if you do checkups and stuff with your provider, then it's really best for you. So then something can be caught from the beginning. So
Wow. I mean, there's a lot to always consider, but please consider your health. It's first and foremost.
it is.
Without your health, it makes it kind of rough
It
to
does.
enjoy family and friends and getting around and doing things you want to do. So keep your health up as much as possible. Amber, thank you for coming in.
Well, thank you
You
for
have such a
having me.
plethora of different expertise.
Well-
I mean, it is interesting because most people have no idea about dressing a wound
Right. Right.
or how to do it properly. What to look for. And I think a lot of us, we get pretty complacent when we get something done to us that maybe it would be wise for us to learn a little bit of that,
Right.
because, hey, you never know when a cut's going to happen. Something that might end up stepping on a piece of metal in the middle of a forest.
Right.
It does happen.
It does.
There's stuff, who knows where it come from,
Yeah.
but it's there.
Right.
That people really need to know how to bandage. And some people say, well, I'll just walk it off. Well, last thing you really want to do is try and walk off a cut.
Right.
Or, on your foot or something in a forest or on a beach. That's probably not the wisest thing to do.
No.
Sounds like infection's going to set in pretty
Yeah,
quick.
sounds like it.
But anyway, we really appreciate your insight on a lot of these different things. Really thank you for coming in, spending some time with us. Hope you're going to have a fantastic day. Amber has her Chiefs sweatshirt on.
Oh yeah, go Chiefs.
She's pumped.
Oh yeah.
Amber Hogan from SMH. We appreciate you, Amber, coming in and spending some time with us here on KSMO. All right, stick around. Civic happenings are coming your way.